And you've seen this change just during your own practice?
I have, yes. And I've seen, and that's the way I work with my physicians, and I think that's the way many physicians now work with their patients. It's less authoritative, less didactic, it's more friendly towards the patient. However, there is sort of a bottom line. If a patient said, let's say a patient needed a medicine for their heart, I think most physicians would say, if the patient balked, you really need this medication. This could be life-saving for you. I don't agree with you not wanting to take it. I can understand your hesitancy, but I really want you to consider it.
Right.
So I think there would be sort of a point, a fall-off point, where as a physician you sort of have to say, look, you really need this. You know, for example, a patient fell the other week. She had a horrible abrasion on her leg, and I said, you really need to get an x-ray. She didn't want to get an x-ray. And I said, but you're elderly. She's a white female, high risk for osteoporosis. I said, I really advise you to get an x-ray. So she did. It was negative, which is great. And I told her, you know, physicians are in sort of sometimes a lose-lose situation. If we don't get a test, oh, that person's negligent. If we push for a test, oh, they just want to do a lot of tests. We don't get a benefit out of doing the x-ray. Our only benefit is to help the patient. And I think sometimes that gets lost in the whole spectrum of looking at, trying to evaluate what a physician is doing.
I noticed a lot of stuff about dermatology on your website.
Yes, we do. We offer many skin care services. We have an esthetician who comes here and does facials. We also provide microdermabrasion, oxygen facials, laser hair removal, pulsed light laser to help people who've had sun damage to their skin, and we do Botox and Juvederm. And we do Botox for cosmetic and for therapeutic reasons. So there are some patients who have severe neck pain or cervical dystonia, and their insurance companies may cover part of the cost of that. So we do a whole range of services, and that's another way to help people, and we love doing it. It's really great. So let's say we'll have someone come in for acupuncture, their pain is improved, and then they see that we do other things, so then they want to do those other things with us. So that's really great.